Okay, good afternoon, everybody. Thanks so much for being here. This is Rachel Powers Doyle, and I'm with the Communications Department at Methodist Le Bonheur Healthcare. In just one moment, Dr. Shirin Mazumder is going to speak, and afterward, she'll take questions. We'll try to get to everybody's questions, but if we run out of time, you're more than welcome to shoot your questions to me through email. Just a reminder, if you can put yourself on mute unless you're asking a question, that would be a huge help. And with that, I'm going to hand it over to Dr. Mazumder.
Hey, thanks, Rachel. Good afternoon, everybody. My name is Dr. Shirin Mazumder. I'm an infectious disease physician with Methodist Le Bonheur Healthcare. I work primarily outside of the hospital setting. I work at the Methodist Infectious Disease Clinic. And as we head into flu season, I have a lot of patients that are asking questions and they have concerns about the upcoming flu season and what it may look like amid the COVID-19 pandemic.
Sure.
Patients are asking a lot about the differences between flu and COVID and what measures they can take to protect themselves. So I wanted to talk a little bit today about some of the guidance that we are giving our patients and some of the recommendations that we have. I have not yet encountered a patient with the flu this season as of yet, but I expect that to change in the coming months. There are several similarities between flu and COVID. They are both highly contagious respiratory viruses, and they are transmitted the same way as well. The incubation period, which is the period of time that the infection starts to the appearance of symptoms, are a little bit different for each virus. With the flu, it typically takes about 1 to 4 days before symptoms appear. On average, it is about 2 days. And with COVID, that period is a little bit longer, usually about 2 to 14 days, and on average, about 5 days. When symptoms do develop, both viruses can cause an asymptomatic infection, meaning patients may not exhibit any symptoms. But when symptoms do develop, particularly early on, it may be very difficult to tease out what is flu and what is COVID. Both infections can present with fever, runny or stuffy nose, headache, body ache, sore throat, cough, shortness of breath, and headache, and sometimes even nausea, vomiting, and diarrhea. However, if patients develop the loss of taste and or loss of smell, typically that is more likely to be COVID, and that occurs in about 10% of patients. The period of time that patients are sick with flu usually ranges between 2 and 7 days. And that period of time is typically longer with COVID. Patients that have mild symptomatic COVID infection are usually ill for 2 or 3 weeks. And that time period is longer if the patient has moderate to severe COVID symptoms. The mortality rate is also different. With influenza, the mortality rate every season is about 0.1%. And the mortality rate with COVID right now is about 3%. Patients have also been asking about how long they need to remain in isolation if they develop influenza versus what that period of time looks like with COVID. And usually what we tell our patients with influenza when they develop the flu, that they should remain isolated for 24 hours after their fever resolves. So usually that's about 3 days or so. And that period of time is longer with COVID. Typically, we recommend that patients remain in isolation about 10 days after symptom onset or 10 days after a positive test. Another question that patients have is, what can they do? Are there any treatment options available? And what I tell my patients is, at this time, there is no curative treatment option for the flu or for COVID, but it's really important that patients reach out to their physicians and their healthcare team if they become sick. For the flu, we do have some antiviral medication options that can cut down on the number of days that a patient is ill. And usually these medications need to be started quickly, so usually within 48 hours to have the best effect. With COVID, we don't have a lot of great treatment options, unfortunately, and especially in the outpatient setting. We usually recommend supportive care, but again, it's important for patients to continue to talk with their doctors and their healthcare team if they are diagnosed with COVID, because we want to ensure that patients are improving and they're heading in the right direction. Another question that patients are asking me this year is what happens, or is it possible to have COVID and flu at the same time, and what happens if that develops? And the answer to that is yes, it's possible to have a co-infection, meaning a dual infection with COVID and flu. And there have been some cases reported in a minority of patients in other countries, so we know that it can happen. But right now, we don't really know what that means. We don't know if that confers a worse prognosis for patients or if they develop a more severe illness. So that remains to be seen. The best thing that patients can do to prevent flu and COVID is to continue to practice the mitigation strategies that many are doing right now, and that is social distancing, masking, and good hand hygiene. And all of those measures are protective against developing COVID and also influenza. And another tool that we have to prevent the flu is the flu vaccine. And I've been receiving a lot of questions about the flu vaccine this year. And we know it works. It is helpful. It can decrease the severity of illness. It can reduce rates of mortality and hospitalizations. So we recommend that everybody get their flu vaccine. And if there is a year to get the flu vaccine, this is it. It's an important year that everyone should be vaccinating if possible. Some patients are asking if there'll be enough flu vaccines to go around this year. And the production of flu vaccines is projected to increase by about 15%. So we anticipate that there should be an adequate supply of the flu vaccine this year. And another popular question right now is about the timing of the flu vaccine. Patients are asking what the best time is to get their vaccine. And we typically recommend that people start getting their vaccine now, and certainly by the end of October, everybody should get their flu vaccine if possible. The flu typically peaks between December and February. However, it is possible to get the flu earlier, and we do see cases in the fall. And it takes about 2 weeks for the vaccine to become effective. And we like to remind our patients that flu vaccines are so important because it not only protects the individual that is getting the vaccine, but it protects the people around them and also decreases the strain of healthcare facilities. So it's very important. And while I operate outside of the hospital setting, I can give you an updated system summary. As of this morning, MLH has 93 admitted COVID-19 positive patients. Last week at this time, we had 64 COVID positive patients. Today, 47 COVID-19 positive patients are in the ICU, and that compares to 31 last year. As of this morning, Methodist Le Bonheur Healthcare has 16 ICU beds available system-wide. Last week at this time, we had 20 ICU beds available. The number of total operational beds fluctuates throughout the day based on staffing and availability. And with that, I'll turn it over to Rachel.
Great, thanks so much, Dr. Mazumder. We're now going to accept questions. So if you have a question, if you can utilize the raise the hand button, that would be fantastic. Again, how you can find that is at the bottom of the Zoom window, you'll see the participants button. If you click on that, a panel is going to pop up on the right-hand side, and at the bottom of that panel, you'll see where you can raise your hand. And with that, let's go to Sam Hardiman with the Commercial Appeal. Sam?
Hi, thank you for taking the time today. To what would you attribute the influx in patients, COVID positive patients in the Methodist system over last week?
Hi, Sam. Thanks for your question. Yeah, I think that the increase in cases is I think the holiday has something to do with that. And we typically see that after each holiday, after Memorial Day and July 4th. So I think that the Labor Day holiday has something to do with that. I think people tend to gather with the holidays, and a lot of these holidays are eating holidays, so people take off their masks and they kind of let their guard down. So I think that has something to do with some of the increased numbers that we're seeing.
Sam, you
Thank
got a
you.
follow-up?
I don't at this time.
Thank you.
Okay, great. Anybody else have a question? You can raise your hand. In the meantime, Dr. Mazumder, what would you say is the #1 question that you're getting from your patients regarding the
Yeah,
flu?
patients want to know what they can do to protect themselves. The flu vaccine is the #1 question, when, if they should get their flu vaccine and when they should get it. So that's an area that has a lot of questions. And again, we recommend that everybody get their flu vaccine, especially this year.
Great, thanks so much. I'm not seeing any other hands. So before we go, Dr. Mazumder, do you have a final message?
I do, yeah. I just want to thank everybody for being here today. And there are some uncertainties as we head into the flu season. So it's important that we all continue to practice the measures that we know work. And masking is so important. I tell my patients to avoid the 3 C's, and that's closed spaces, close contacts, and crowded places. And like I mentioned earlier, it's so important that we all are vaccinated this year for the flu. And if patients have questions about the flu or COVID, it's important that they reach out to their physicians and their healthcare team. MLH, we are committed to our patients and our community, and we will continue to do so as we head into the flu season.
Thanks so much, Dr. Mazumder. Before I end the meeting, I do want to let everybody know that tomorrow night, on Wednesday night, we're hosting a live public forum on our Facebook page about mental health. We're going to talk about how to look for stressors in your life and when we need to seek professional help. So that's happening at 7 p.m. on the Methodist Healthcare Facebook page. We want to make sure that the public knows that they're invited to watch and ask questions. So I'll email out more details this afternoon about that event. Otherwise, we're going to see you guys back here on Thursday morning. So thanks so much, everybody, and have a good day.